When the cells of the breast grow uncontrolled due to any mutation in the DNA of the cells, these cells are called tumor cells. This leads to a collective mass of cells in the milk ducts or nodes, which is called breast cancer. Everybody is born with a small amount of breast tissue, so either man or woman can get this disease. The chance of this disease in men is rare compared to women. 2022 report by the World Health Organization reveals that about 670,000 deaths occurred globally due to breast cancer. The main cause of this fatal disease is still unknown. An affected person usually feels a lump or mass of cells in the breast, and changes in the shape and size of the breast occur, which are examined by different treatments. There are no preventive measures by which someone can prevent this disease. Let us discuss the risk factors of this disease, which could lead to fatalities, and also describe the treatment procedure for this disease. What is meant by breast cancer? Cancer is a condition in which the growth of the body cells becomes uncontrolled. In breast cancer, the cells grow in the breast tissues, multiply there, and lead to a tumor. It has been reported that, in 60% of cases, this tumor can spread to other parts of the body. Breast cancer is the second most common cancer in women aged 50 or older. But it's not specific to women. Men are also affected by this disease. How are cancer cells formed? Cancer cells are known as the growth of muted cells. As cells of the body have a normal life cycle, they grow, divide, and die, eventually replacing other new cells. All messages they receive are from specific DNA of specific cells. Some mutations occur in the genes of that DNA. Ultimately, it sends an abnormal signal. Cells receive that signal and start to produce extra cells as mutation. This abnormal growth of cells can sometimes be non-cancerous, but occasionally cancerous. Cancerous cells easily spread to other parts of the body. Types of breast cancer. There exist many types of breast cancer, depending upon its origin. Some common types of breast cancer include invasive ductal cancer, a type in which cancerous cells start to produce in the milk ducts, known as nipples, and spread to other nearest tissues. This type of breast cancer is most common in women, especially in the United States. Lobular breast cancer. In this type, the cancerous cells grow in the glands, which produce milk known as lobules. These abnormal cells then further spread to other breast tissues. Ductal carcinoma in situ. This breast cancer is also related to milk ducts, but it's not spread to other parts of the body. Triple-negative breast cancer. It is an invasive breast cancer that spreads quickly among all other breast cancer types. Inflammatory breast cancer is also called fast-growing cancer. In this type, a rash appears on the breast. Paget's disease of the breast. In this type of breast cancer, the abnormal cells affect the skin of the nipples and appear as a red rash. It exists in about 4% of all types of breast cancer. Triple-negative breast cancer, inflammatory breast cancer, and Paget's disease of the breast are less prevalent types of breast cancer. Some subtypes also exist. These types are known as receptor-specific cancers. Receptors are protein cells that exist in or on the surface of the cells. These attract particular substances in the blood, like estrogen and progesterone. Breast cancer having estrogen receptors is called ER-positive. PR-positive types contain progesterone receptors. HR-positive means cancerous cells have both estrogens and progesterone receptors. If cancerous cells lack progesterone or estrogen, then it's known as HR-negative. What are the causes of breast cancer? The leading cause of breast cancer is still unknown. However, numerous factors can cause breast cancer, including lifestyle habits, environmental factors, and hormones in the body. It is said that breast cancer is the result of your genetic makeup and the things that surround you. As we told you earlier, mutations in the DNA cells could lead to breast cancer. Let us discuss the risk factors that may increase the chance of getting breast cancer. What are the risk factors of breast cancer? Family history, personal history, breast condition, menstruation cycle, menopause at old age, breast tissue condition, alcohol drinking, increased age, and not being pregnant are some factors that can influence breast cancer. Family history. If a person's sibling or parent has breast cancer, his risk of getting breast cancer is increased. A person has a higher chance of being affected by breast cancer if there are multiple family members with breast cancer. However, it is not ultimate. Some people have breast cancer, but their family history does not belong to it. Personal history. If someone has breast cancer in one breast, he may get it in the other breast also. Breast condition. Some specific conditions of the breast can increase the risk of breast cancer. These conditions include lobular carcinoma, in situ, and atypical hyperplasia. Early age menstruation, the start of periods before age 12, can also increase the risk of breast cancer. Menopause at an older age. Menopause at an older age, almost 55 or older, can also cause breast cancer. Breast tissues. Two types of breast tissues exist: fatty tissues and dense tissues. Dense tissues consist of milk glands, milk ducts, and fibrous tissues. If someone gets cancer in thick tissues, then the chance of breast cancer is increased. A mammogram detects it. Alcoholism. Drinking alcohol can also increase the risk of this cancer. Older age pregnancy. Giving birth to a child after age 30 can also influence breast cancer. Age. The chance of getting breast cancer increases with age. Menopausal hormone therapy. Getting specific types of hormone therapy medicines to control menopause symptoms can also increase the risk of breast cancer. Obesity. As it is said that obesity is the mother of all diseases, it can also lead to breast cancer. Radiation treatment. If someone gets radiation treatment at a younger age, he can get breast cancer. Difference between breast cancer forms in men and women. Each person born with little breast tissue, either man or woman, has these tissues gland and duct, which lead to nipples and carry milk. At puberty, these breast tissues in men do not grow, but in females, they develop into more breast tissues. The earlier breast tissues in men can cause breast cancer. Men's breast cancer cases are rare but exist. Those men who are born with Klinefelter syndrome have a greater chance of getting breast cancer. In this condition, an extra X chromosome is developed in the male, which affects testicle development and causes changes in hormones in the body. These changes increase the chance of breast cancer in men. What are the symptoms of breast cancer? The breast is affected by this disease in multiple ways. Symptoms vary depending on the conditions. In some cases, the affected breast area looks different from other parts. This disease may not cause any specific notable symptoms, but some changes could be seen, which include change in the size, shape, and contour of the breast. A collective mass felt like a small pea in any breast area. Any small lump near the breast or in the underarm that persists during menstruation. A small net of another skin may appear on the nipple or breast. Sometimes, the skin of the breast looks scaly, and the color changes and may become red, purple, or darker. A hardened area fell under the skin. The nipple may look turned inward. A blood stain or dully fluid may discharge from the breast's nipples. How is breast cancer diagnosed? To check the signs and symptoms of breast cancer, the doctor or physician first takes a physical examination of the breast or uses a mammogram. A mammogram is a test in which a doctor takes a picture of the breast. It is recommended after early signs of breast cancer. Some tests can also be performed to check the root of breast cancer, its stage and type. These tests may include breast ultrasound. After finding the symptoms of breast cancer, an ultrasound is recommended. It can give a detailed image of the breast. It can also provide an idea about whether the lump is solid or fluid-filled. Breast MRI. It is an imaging test that can give a clear image of the breast. This test is also used to diagnose abnormalities in the breast. Breast biopsy. It is only recommended when a nearer area of the breast has a lump or mass of something. About 80% of the results of this test reveal no breast cancer. Immunohistochemistry. This test is used to check the hormone receptors of cancer. Genetic tests to know about the mutation in the gene that causes breast cancer. Treatment of breast cancer. A breast cancer patient is treated by more than one process, which may include surgery, in which a doctor cuts the part of the cancer. In chemotherapy, particular drugs are recommended to be inhaled that can kill cancer cells. These drugs may be pills or intravenous medicines. Hormonal therapy. In this process, specific hormones are given to an affected person, which blocks the cancer cells. Biological therapy. This therapy can fight against cancerous cells and control the side effects of other treatments. Radiation therapy. High-energy rays are used to kill cancerous cells. Can breast cancer be prevented? Breast cancer can't be prevented, but its risk factors could be reduced. Try to get and keep a healthy weight. Your healthcare provider will give you a chart for healthy weight management. Try to keep a healthy diet, which includes vegetables, fruits, calcium-rich foods, and proteins. Regular physical activities can also lower the risk of breast cancer. Avoid drinking alcohol. Is breast cancer fatal? At an earlier stage, cancer is not life-threatening. When cancerous cells spread to other side tissues of the breast, they are known as invasive cancer cells at that stage. These may lead to further lymph nodes, or even other organs known as metastasizing. This stage could be fatal. If you enjoyed this video, don't forget to like, share, and subscribe to our channel for more captivating content. And as always, stay curious and keep exploring.